A neurological examination is the assessment of sensory neuron and motor responses, especially reflexes, to determine whether the nervous system is impaired. This typically includes a physical examination and a review of the patient's medical history, but not deeper investigation such as neuroimaging. It can be used both as a screening tool and as an investigative tool, the former of which when examining the patient when there is no expected neurological deficit, and the latter of which when examining a patient where you do expect to find abnormalities. If a problem is found either in an investigative or screening process, then further tests can be carried out to focus on a particular aspect of the nervous system, such as lumbar punctures and blood tests. In general, a neurological examination is focused on finding out whether there are lesions in the central and peripheral nervous systems, or there is another diffuse process that's troubling the patient. Once the patient has been thoroughly tested, it is then the role of the physician to determine whether these findings combine to form a recognizable medical syndrome or neurological disorder such as Parkinson's disease or motor neuron disease. Finally, it's the role of the physician to find the causative reasons for why such a problem has occurred. For example, finding whether the problem is due to inflammation or is congenital. A neurological examination is indicated whenever a physician suspects that a patient may have a neurological disorder. Any new symptom of any neurological order may be an indication for performing a neurological examination. Specific tests in the neurological examination include mental status examination, cranial nerve examination, motor system, deep tendon reflexes, sensation, and lastly cerebellum. Hi, good day. Today we're going to be doing different tests for the neurological assessment. And my name is RJ Bartolome. My partner's name is
Lapuz.
For the first part of the test, it includes the 12 cranial nerves. The 12 cranial nerves include the olfactory nerve, the optic nerve, oculomotor nerve, trochlear nerve, trigeminal nerve, abducen nerve, facial nerve, vestibulocochlear nerve or the acoustic nerve, glossopharyngeal nerve, vagus nerve, accessory nerve, and hypoglossal nerve. These are the 12 pairs of cranial nerves that originate from our brain and brainstem. Each of them carries different functions related to different senses of the body. Apart from sensory functions, there are also some that work as motor nerves or mixed nerves. First one would be testing the olfactory nerve. The first nerve is the olfactory nerve. This is a type of sensory nerve that contributes in the sense of smell in human being. These basically provide the specific cells that are termed as olfactory epithelium. It carries the information from nasal epithelium to the olfactory center in the brain. What we have to do is, the patient has to distinguish two different scents, and for her to be able to do that, she has to close her eyes. Miss Erica. And then I'm going to have her smell two different things. This one and this one. Now she has to distinguish which one is which. Now I have to close one of her nose, one of her nostrils, and make her smell one. Can you determine what that was?
Super cute.
Okay, good. And then the next one is?
Coffee.
Alright, good. And now we have the optic nerve. The second cranial nerve is the optic nerve. This is a type of sensory nerve that transforms information about vision to the brain. To be specific, this supplies information to the retina in the form of ganglion cells. This one senses, or we have to use a pen light, and we have to see if her pupils constrict or dilate with a pen light. 3, 4, and 6 have to do with her eye movements or have to do with her eye muscles. The third cranial nerve is the oculomotor nerve. This is a form of motor nerve that supplies to different centers along the midbrain. Its functions include superiorly uplifting eyelid, superiorly rotating eyeball, construction of pupil under exposure to light, and operating several muscles. The fourth cranial nerve is the trochlear nerve. This motor nerve also supplies to the midbrain and performs the function of handling the eye muscles and turning the eye. The sixth cranial nerve is the abducens nerve. This is a type of motor nerve that supplies to the pons and perform function of turning eye laterally.
What I'm gonna have her do is follow my fingers without her head moving. It's just her eyes. So just follow my finger. And the next cranial nerve that we're going to be testing is the fifth cranial nerve, which is the trigeminal nerve.
The fifth cranial nerve is the trigeminal nerve. This performs many sensory functions related to the nose, eyes, tongue, and teeth. It basically is further divided into three branches that are ophthalmic, maxillary, and mandibular nerve. This is a type of mixed nerve that performs sensory and motor functions in the brain.
What I'm going to have her do is clench her teeth and move her teeth from side to side while I have my hands on her on her cheeks. Clench and then move. And the seventh cranial nerve would be the facial nerve.
The seventh cranial nerve is the facial nerve. This motor nerve is responsible for different types of facial expressions. This also performs some functions of sensory nerve by supplying information about touch on face and senses of tongue and mouth. It is basically present over brainstem.
What I'm going to have her do is close her eyes, and we're going to use a Q-tip or a cotton bud, and she's going to determine whether this is the soft side or the sharp side. Can you tell me which side is this? And this? Okay. And another thing where you can test the facial muscle movement is have the patient smile and have her frown, and now puff out your cheeks. And the eighth cranial nerve would be the acoustic nerve.
The eighth cranial nerve is the acoustic or vestibulocochlear nerve. This motor nerve is basically functional in providing information related to balance of head and sense of sound or hearing. It carries vestibular as well as cochlear information to the brain and is placed near inner ear.
What I'm going to have her do is repeat what I whispered to her. Apple. Banana. Okay. And then we're going to do the Weber's test using a tuning fork, and for the Rena's test is a tuning fork also. Tell me when it stops, okay? And then for the Rena's test, the Rena's test for the air conduction and the bone conduction. The ninth cranial nerve, which is a glossopharyngeal nerve.
The ninth cranial nerve is a glossopharyngeal nerve. This is a sensory nerve which carries sensory information from the pharynx and some portion of tongue and palate. This information sent is about temperature, pressure, and other related facts. It also covers some portion of taste buds and salivary glands. The nerve also carries some motor functions, such as helping in swallowing food.
We're going to have the patient swallow. And the 10th cranial nerve would be the vagus nerve.
The 10th cranial nerve is the vagus nerve. This is a type of mixed nerve that carries both motor and sensory functions. This basically deals with the area of pharynx, larynx, esophagus, trachea, bronchi, and some portion of the heart and palate. It works by constricting muscles of the above areas. In the sensory part, it contributes in the tasting ability of the human being.
Now, what I'm going to have her do is open her mouth, stick your tongue out a little bit and test it. Test the uvula. Now we're going to be testing the 11th cranial nerve, which is accessory nerves.
The 11th cranial nerve is accessory or spinal accessory nerve. This motor nerve supplies information about the spinal cord, trapezius, and other surrounding muscles. It also provides muscle movement of the shoulders and the surrounding neck.
What I'm going to have her do is try to resist the force that I'm going to put on her shoulders. First, the left side. Now the right side. Both. She's going to have to try to resist my hands on her cheeks. The last cranial nerve, or the 12th cranial nerve, would be the hypoglossal nerve.
The 12th or the last cranial nerve is a hypoglossal nerve. This is a typical motor nerve that deals with the muscles of the tongue.
What I'm going to have her do is stick her tongue out all the way down. What we're trying to look for here is if the tongue's symmetrical or if it deviates to the left or to the right.
Part 2 is about the motor, gait, and coordination. The motor system evaluation is divided into the following: body positioning, involuntary movements, muscle tone, and muscle strength. Coordination and gait are usually described under a separate section because cerebral disorders can disrupt coordination or gait while leaving other motor functions relatively intact. There is much overlap, however, between the systems being examined in this section and those examined in the earlier general motor exam section. Keep in mind that disturbances of coordination and gait can be caused by lesions in many systems other than the cerebellum.
Testing her coordination. I'm going to have her stand up, please. Turn to side. Close your eyes. Have your hands forward. Now we're going to be testing her gait. I'm going to have her walk forward and then go backwards. And now walk with your heels. And now back with your toes. And now I'm going to have you bend your knees. Now we're going to have her test the rapid altering movement. I'm going to have her follow my instructions and she's going to have to do it from slower to faster. Now do this, clap, then up, down, down. Now faster. And now she's going to have to follow, or she's going to have to point to my finger and touch her nose. I'm going to be testing her muscle strength for her hands. She's going to try to resist. Okay, that's good. And then try to resist. And then for her legs, can you pull it up? The next one.
The sensory exam relies to a large extent on the ability or willingness of the patient to report what he or she is feeling. It can therefore often be the most difficult part of the exam to interpret with certainty. Tests should be performed in all extremities, as well as on the face and trunk, with the patient's eyes closed or covered.
And for the second to the last of our test would be the sensory function. What I'm gonna have her do is sense the sharpness of the object that I'm gonna put on her skin. She's gonna tell me where I placed it. Close your eyes. Left. Right. We're gonna be testing the stereognosis, which is she has to figure out what I'm gonna put in her hand. Close your eyes, open your palm, and tell me what I put. It's a coin. Now we're gonna do the graphesthesia, I'm gonna write something or a number on her palm, and she has to tell me what number it is.
3. 1.
Okay. And then for the point localization, she's still gonna have her eyes closed. I'm gonna touch the patient and ask her where I touched her, and point to me where it was.
Left.
The last part for the sensory function would be the 2 points. She's gonna tell me how many points I'm pointing on her skin.
2. 1. 2.
Deep tendon reflexes. Using a reflex hammer, deep tendon reflexes are elicited in all 4 extremities. Note the extent or power of the reflex, both visually and by palpation of the tendon or muscle in question.
And now for the last part of our neurological assessment, we're going to be testing her reflexes. And first we're going to start with her elbow reflex.
The triceps reflex is measured by striking the triceps tendon directly with a hammer while holding the patient's arm with your other hand.
Her brachioradial.
The brachioradialis reflex is observed by striking the brachioradialis tendon directly with a hammer when the patient's arm is resting.
Her patellar reflex.
With the lower leg hanging freely off the edge of the bench, the knee jerk is tested by striking the quadriceps tendon directly with a reflex hammer.
The last part is the Achilles reflex. I'm going to have her stand and put one knee up, and then the Achilles reflex.
The ankle reflex is elicited by holding the relaxed foot with one hand and striking the Achilles tendon with a hammer and noting plantar flexion.
Okay, now that sums up the neurological assessment, which includes the 12 cranial nerves, the motor nerves, the sensory nerves, and the reflexes. Again, I'm RG Bartolome.
And I'm Maria Erica Lapuz.
And thank you for watching. And my name is RG, and this
I'm
is
Erica.
and we are good day. Good day. We're gonna be performing a series of tests for the neurological assessment today. And my name is RG, and this
I'm
is
Erica.
and we are
The biggest.
Hi, good day. Today we're going to be performing a series of tests for the neurological assessment. Hi, good day. Today we're going to be performing a series of tests for the neurological assessment. And my name is RG and my partner's name is
Erica Lapuz.
Okay. Smile, frown, tapos puff out your teeth. Kasi naiisip ko, gumaganon. Alright. Ulit.
Dali ka, dili.
Okay, now we're gonna be testing the 11th.
Nahuli yung record.
Di pa nag-stress. Ala pa naman.
Mami, Beth, sabihan mo nga to.
So for the last part of our neurological assessment, the first test we're going to be performing today has to do with the 12 cranial nerves. The first test that we're gonna be the first test has to do with the olfactory nerve, and the first test is the olfactory nerve, and that's for the sense of smell. So in order to test the sense of smell, the patient has to close their eyes. Can you close your eyes? And
What? Pose. Baba mo isa. First, close muna isang nostril. 1, 2, 3.
kasi nakita ko. Bakit may umilaw ka? Kasi yun eh. So first we have to close one. So we're gonna first include or close one of her nostrils, and we're gonna tell her to smell one of our scents, and she's gonna tell us which one it is. And we are
The biggest.